Okay, so I walked in and washed my hands prior to this. I reviewed the medical record. Hi, my name is Caleb Stanley. I'm a student physical therapist assistant at Vincent University. Can you verify your name and date of birth?
Allison Rush, May 19th from 98.
All right, that checks out what I have. So I saw that you had a total hip replacement on that right leg. And today we're going to try to get you up and walking. We're going to do some therapeutic exercise. Is that something like you'd like to do today?
Yes.
Okay, very good. And the purpose of these therapeutic exercise is to kind of strengthen up those leg muscles, promote some blood flow, and which will promote healing, which will get you better and stronger, and hopefully get you walking out of here pretty soon. And with the get you up and doing some walking around, we're gonna test that leg today. Try to see get you ambulating, and that decreases things like pressure ulcers and stuff like that.
Okay.
Okay, so that's the purpose of that. Can I have you fill out this questionnaire for me, please?
Sure.
Thank you so much. Wonderful, wonderful. All right, now that I've done that, let's see. Can you tell me what your pain is today?
It's pretty high. I want to say like a 7 or 8.
It is pretty high. Where's the pain at? Where's specific?
On my right hip.
Right hip, right. Where at? On the side more, or?
More like on the side.
Right in there. Okay, okay. I'll go ahead and write that down. Let me go ahead and take your oxygen
Okay.
level before we get started. Make sure it's at acceptable levels for a therapeutic exercise. It looks good to me. Now that I've done that, can you once again verify who you are?
My name is Allison Rush.
Okay. Can you verify where you are?
I'm in the hospital.
Hospital? Do you know what time it is?
I don't know specifically, but I want to say it's late afternoon.
Late
It's
afternoon?
Like 5, 6, somewhere.
It's pretty close. It's actually 3 o'clock, but
Okay.
not too bad off. I'll go ahead and make a note of that real quick before we get started. All right, now that we've gone through all that, I want to talk to you about your hip precautions. So now that you've had this significant surgery going on, there's some things you can't do just yet. Chiefly one of those, I don't want you bending over 90 degrees. See how I'm bending over nose over toes? I do not want you doing that.
Okay.
And I do not want you crossing that affected leg, that right leg. I do not want you to bring over the left leg. And can you see me fine? Okay, the first thing, and the other thing I don't want you doing, I don't want you to bring an internal rotate. I don't want you to bring the toes, point at the other toes. See how I'm doing that?
Yeah.
I do not want you to do that. And the reason why I don't want you doing any of these movements is that you can dislocate that hip you just had surgery on, and you would start up at square one. Yeah, I don't want that either. I don't think none of us want that. So for now, avoid those movements.
Okay.
Okay, and can you go over those hip precautions I just told you?
Not to flex past 90 or like bend down and reach past 90. Or internally rotate. This is my good leg.
Yes, I was like, whoa.
This is my good leg, but I
Okay.
don't want you to point my toes to my other toes or like cross the midline.
Yes, do not cross the leg. Exactly. Very good. All right, now that we've gone and done that, let's go ahead and get started on our therapeutic exercise. And again, the whole purpose of this, strengthen up those leg muscles, promote blood flow, and now promote some healing, get you stronger.
Okay.
That's what we want. So the first thing I'm going to get down to your level. First thing I want you to do is I want you to, like a gas pedal, I want you to go ahead and bring this foot down to my hand. Good. I want you to do 10 of these, okay?
Okay.
Nice and controlled. Everything feel okay? Any pain with that?
A little pain.
Little pain?
Not much.
Okay. Good. Go ahead and do 10 for me, please. Call these ankle pumps. Very good, very good. Okay, so I'm going to go ahead and place my hand underneath your knee right here. And I want you to smash that knee into my hand.
Okay.
Go ahead and do that. Go ahead and do it one more time. Good. Yeah, you feel those muscles contracting. I want you to hold it for a few seconds, then relax. We're going to try to do 10 of these as well, okay?
Okay.
Good. And this is working those thigh muscles. I can feel them contracting. Good deal.
That's probably as much as I can do.
Much as you can do, okay. Very good. Some is better than none, right? All right, I'm going to lift up your leg a little bit. Feel okay?
Yep.
All right, I'm going to put this bolster for the day. And what I want you to do, these are going to be called SAQs, or short arc quads.
Okay.
And I want you to do is to raise this leg up, right here, the lower leg. Yep, right in there. I'm going to try to touch my hand. Good. Good. I wanted you to do 10 of these as well, right?
Okay.
Everything feeling okay? Any pain or discomfort?
A little pain, but nothing too bad.
Nothing too bad? Alright. I'll take it. Nice. Okay, I want to go ahead and move that out a bit. Okay, the next thing I want you to do is I want you to go ahead and squeeze your butt cheeks together. Okay? Feel nice. Hold it for a couple seconds, then relax. Okay, good. I want you to do 10 of these as well. Okay?
Okay.
Any pain with this one at all?
Mm-mm.
No? Good, good. Call these glute sets. And now that we've gone through most of these exercises, what I want you to do, probably 3 times a day, is try to go ahead and do these.
Okay.
Try to get for that number 10. Okay, good, good. Okay, sit back up. Tap on my hip. So, okay, we've done that. I got one more exercise for you, but that'll be later on when we're ambulating, okay?
Okay.
Alright, so now I'm going to go ahead and lock the bed. I'm going to go ahead and put on the non-slip socks. And now we're going to try to get you ready to sit up, alright? Okay, so I want to kind of guide this leg over. I want you to kind of come towards me. So these legs are going to be coming out this way, alright?
Okay.
Alright, and when I get you to sit, I want you to have that leg, the affected one, kind of like this. I don't want you to, remember the hip precautions, don't bring it over, don't bend over, and don't internally rotate, okay? Just try to keep that leg as straight as possible, alright? Now I'll help guide you. I want you to get up on your on your elbows. Can you do that?
Yeah.
And I want you to kind of work your way.
Okay.
Alright, I'm going to be guiding this as well. Work as much as you can. Good, good. Yep, try to scoot forward as well. Good, good. Okay, I'm going to relax that. You feeling alright? Okay, good. And now, remember, you're going to be weight bearing this toddler. I'm going to have a walker out here for you. But I want you to kind of test that leg. Put a little weight and put some weight on it. If it hurts too much, ease up on it a bit. But again, we want to try to work that leg. Don't try to baby it as much, alright?
Okay.
And I don't want you in pain though. I can find the hole. Unconventional gait belt, but it's fine. It's fine. Alright, I'm going to be guarding that affected side. So I'm going to put the walker right in front of you. And when you sit up, I want you to grab a hold of the walker, okay?
Okay.
And remember, as you go, I want you to put most weight on the unaffected leg, okay? I'm going to guard this side on 3. 1, 2, 3. Push up. Okay, good, good. You alright? Alright, let's go ahead and ambulate to my left. Don't cut me off though while we're walking, okay?
Okay.
Okay, good. Good. Yep, try to test that leg out. Put some weight on it. If it gets too much, let me know. Let's go ahead and start turning a little bit. See that right here, that chair? We're going to make our way to it. We're going to do our final exercise. Okay? Okay, now we're ready here. I'm going to go ahead and move the walk. Yep, go ahead and grab a hold of that. So the final exercise I want you to do is I want you to go ahead and bring your affected leg out to the side.
Okay.
Straight out to the side as much as you can. A little bit, yeah. I don't want you compensating with these hips. I want to try to keep these hips level.
Okay.
And just raise it up. Go ahead. Good. I want you to try to do 10 of these, okay?
Yep.
Everything feel okay? Good, good. Okay, good job. Okay, I'm gonna put the walker right in front of you again, right here. You got a hold of it. That. And let's go ahead and kind of walk out a bit here. And I want you to try to sit down, okay? Remember, when you sit down, try to keep that affected leg straight, okay?
Okay.
Let's go sit down. Good, yep, we're not, no nose over toes, nothing like that. Okay, let's go ahead and rest a bit. I'm gonna take your pulse ox again. Make sure everything, your oxygen level's okay, did all that. We did a lot of movements today. Okay, your oxygen level's still good. All right, are you okay to get back to the bed?
Yeah, I think that's fine.
All right, good, good. All right, so go ahead and grab a hold of the walker. Remember, when you stand up, put more weight on that unaffected leg. Keep that leg straight. Don't cross it over. Remember those hip precautions.
Yeah.
Okay, on 3. 1, 2, 3. Okay, good, good. Okay, let's make our way back to the bed now. Okay, good, yep. Okay, remember, what we're going to do when we sit down?
Keep my leg out.
Yep, that's exactly right. And I'm going to go ahead and put a pillow right here to decrease how far you have to sit down. Okay, make it a little bit easier on you, okay?
Yeah.
Go ahead. Good, good, good. Wonderful, wonderful. Okay, I'm going to go ahead and take this belt off. I don't think you want it on anymore.
No.
That. All right, I'm going to try to, so we're going to have to ask you to do one more thing for me. I want to guide this leg up. I want you to scoot back. Try not to be over 90 at all. Okay?
Just go back.
Yep, go back, go back, go back. And relax.
Much better.
Much better. Do you want me to take this pillow out from under you?
Sure.
Okay, let's try to do that a bit. Okay, good. All right. Oops. Can you tell me your pain level is now?
It's still at like a 7. but
Still at a 7? Okay, it's still in that same area?
Mhm.
Alright, I'm going to take your oxygen one more time. Make sure everything's okay. Okay, it's still good. And can you once again verify who you are?
Allison Rush,
Where you are?
the hospital.
Okay, you know what time it is?
It's around 3 o'clock.
Around 3 o'clock? A little past that now, but yeah.
Yeah.
But yes, very close enough.
Okay.
Alrighty, well, that's all I had for you today. And again, remember, 3 times a day, try to do those exercises we did while on the bed, okay?
Okay.
That'll be good. Thank you so much, and you have a good one.
Thank you.